Meanwhile, today, the state announced our weekly COVID case count. And the good news is that it's about 2,000 less cases than last week, with 27,785 reported. Hospitalizations and ICU admissions also declined. Meanwhile, we're seeing an uptick in monkeypox cases. It's now a public health emergency in the U.S. What exactly does that mean, and why is it taking so long to get monkeypox vaccines? Let's bring in senior health correspondent Monica Robbins to answer some questions. Hey, Mon.
Hey, Betsy. Yeah, first and foremost, everybody do not panic. Declaring a monkeypox public health emergency just triggers grant funding and allows the government to buy treatments, medical supplies, and support hospitals. Public health emergencies are in place for 90 days, but they can be extended. Now, there are more than 6,600 cases of monkeypox in the U.S., including 34 here in Ohio. But health experts I've been speaking to believe that number is much higher because it can take up to 3 weeks after exposure before symptoms appear, usually a painful rash. And we also have a vaccine for it, although it is in short supply. But about 1,200 doses will be delivered to the Cuyahoga County Board of Health, who will then distribute them to partner clinics in the LGBTQ community, where the majority of cases are happening.
Last week, the supply was so limited that the only folks who could get a vaccine were people with a known exposure to monkeypox. This week and going into the future, we're really hoping to focus on prevention. If the supply is enough, we'll get it to folks who are highest at risk for getting monkeypox.
Now, there are 2 types of monkeypox vaccines, but the Jynneos vaccine is the most common, and it's given in 2 doses 4 weeks apart and can help prevent the pox, or if given later, can help alleviate those symptoms, Bets.
All right, so let's talk about these vaccines. Why is it taking so long to get that vaccine out there if they already had it?
Yeah, exactly. You'd think we'd have vaccine distribution nailed down thanks to COVID. But keep in mind, we've had a lot of turnover in public health. We have new city and county health directors, and a lot of public health workers retired or left the field after 2 years of the pandemic. So this is this is from the federal level on down. Keep that in mind. So there is a learning curve in some cases. Yes, it is definitely frustrating, but it will not last.
All right, so what are the latest on the monkeypox symptoms?
Yeah, that's what everybody wants to know. Very important to understand, although the majority of cases are in the gay community, anyone can get monkeypox. Already there have been 5 children diagnosed. Now, symptoms are like the flu: fever, headache, muscle aches, swollen lymph nodes, chills, fatigue, and that rash that looks like pimples but can turn into painful blisters. It spreads through direct contact with the rash. Even the scabs are contagious. It can spread through prolonged face-to-face intimacy or contact by touching items that were touched by infection. Infected pregnant women can give it to their fetus, and you can also get it from infected animals. But at this point, Bets, it's something we all need to be aware of, but there's no need to panic, and testing is going to be ramping up, so you can expect those numbers to actually jump in the coming weeks.
Oh my goodness, there's so much to take in on this, and I know a lot of people are very upset about it and very worried about it. We're a little, traumatized after COVID and whatnot.
It's not easy to spread, let me put it to you that way. So if you're not in association with anyone, then you're fine at this point.
That's great news. All right, thanks so much, Monica.